Fear is a basic, universal human emotion. It's something that we all experience, and it's our body's reaction to a threat or danger that's happening right now in our environment. And what fear does is it activates our fight or flight response, which is meant to help us keep us safe. So if there's danger, it gets us to fight and attack that and protect ourselves, or it gets us to flee and get out of there away from the danger. So we often use fear and anxiety interchangeably, right? Sort of in our day-to-day conversations, but they're actually different. So fear refers to a response to a threat that's happening right now in our environment. Anxiety is more future-oriented. So anxiety is worrying about something that could happen, a hypothetical situation, something that may never even happen. And anxiety can be helpful because it's what gets us to prepare, it motivates us, it's what gets us to practice before we have to give a big speech or practice before a recital. But it can also be unhelpful if it's so extreme that it prevents us from doing things that we want or need to do. So being so afraid of speaking that like you can't give a talk at work, for example. And then lastly, anxiety also comes with a lot of worried thoughts, especially about what could happen or worst case scenario. So for example, this is going to be a disaster, or it's going to go horribly, might be an example of an anxious thought. Some common examples of anxiety disorders in kids include social anxiety. And so these are kids who have anxiety in social situations like the name suggests. So for example, they have a really hard time raising their hand in class, asking for help, going to parties, even eating in front of others can be hard. Another common type of anxiety disorder in kids is separation anxiety. And so these are kids who have trouble being away from a caregiver like a parent. And so they might have trouble going to sleepovers or even separating at school during drop-off. And then another really common type of anxiety disorder in kids is called generalized anxiety. And so kind of like the name suggests, these are kids who have lots of generalized anxieties about day-to-day things. So school, health, grades, safety, friendships, things like that. Phobias are a type of anxiety disorder in which we experience an extreme fear response to a specific object or situation. And you know you have a phobia if it causes a lot of distress, it makes you really upset when you encounter that object or situation, or you even think about it, or you go to great lengths to avoid that. So for example, some common types of phobias that we see in children are blood or shots, needles, fears of the dark, thunderstorms, things like that. And of course, most of us are afraid of some things, right? Like most of us don't love getting shots, or we don't love snakes, or for me, sharks. But those things don't necessarily get in the way of our day-to-day lives. And so if you're noticing that your particular fear is getting in the way of you doing the things that you need to do, or you're having a much bigger response than most people would, that might be a sign that you're experiencing a phobia. So the good news is that anxiety disorders, including phobias, are really treatable, and cognitive behavioral therapy, or CBT, is considered the gold standard treatment for anxiety disorders.